Good afternoon, everyone. Welcome to the Insurance and Real Estate Committee's Nonprofit Liability Working Group. Today is Friday, November 14th, 2025, and the meeting has been convened. We'll skip over remarks by the chairs. We're going to move to presentation. We have Kristen Dodanowitz from the Office of Early Childhood here with us today. Thank you. I know you've had a very busy week and a very busy day, so we really appreciate you stepping up here to present. I asked Kristen in OEC to come present just to kind of give us an overview of what's happening here. We've, invested $300 million at the state level in a child care endowment. This is going to be, operated by nonprofits and other entities. There's a lot of announcement from the governor that slots are opening up, and we want to make sure that our goals on this committee make sure that we're including all the things that you guys are working on. And maybe you've come across some things that we haven't talked about yet. So feel free to bring us up to speed on that. I'll pass it over to Kristen Dodanowitz. Thank you, Kristen.
Thank you. And we are very happy to be here I almost said this morning, but it is afternoon now. So I'm Kristen Dodanowitz. I'm the Director of Systems and Policy Planning at the Office of Early Childhood. Also the one overseeing all things endowment. So any questions related to the endowment, please feel free to direct them to me. And I'm joined here today with Deb Fliss, and I will have Deb introduce herself as well. And Deb is actually going to get us started with the PowerPoint. So I'm going to toss it over to her.
Good afternoon, everyone. Deb Fliss, Acting Deputy Commissioner at the Office of Early Childhood, working closely with Kristen and our leadership team around the implementation and the building of the systems that are put in place by this endowment funding. So to begin, next slide, please. There we go. Thank you. All right. So a little bit of context first. The Early Childhood Endowment was established in legislation in the 2025 session. It builds on the work of a blue ribbon panel convened by the governor in 2023. It establishes a program called Early Start Connecticut, which is our program for funding early childhood spaces in community-based and public school settings. We're following a set of guiding principles that I'll walk you through in a moment. And we are using this opportunity of the endowment to address many of the challenges of the current early childhood system. There are actually three things that are at play in the creation of the endowment: a bond bill, HB 5003, which establishes a portal for family access to early childhood spaces, and SB 1, which is actually the establishment of the endowment. Next slide, please, Mackenzie. So a little bit about the guiding principles that we're using as we implement the endowment. We are retaining what we have already existing in the early childhood community, which is a mixed delivery system. The endowment will support providers in childcare centers, group and family childcare homes, and public school settings. We are working in collaboration with the Department of Education, as we have done right along, to support programs that operate in public schools, as well as to collaborate with them on some technical assistance that we'll be delivering. We use common quality standards in our quality improvement work and in our expectations for high quality for providers. We have expectations for teacher qualifications and for national accreditation, which is how we distinguish high quality in our system. We also implement coaching for early childhood programs. Especially through the endowment, we will look at supporting children and families whose children have identified special needs. Through our listening sessions that helped establish the endowment, we learned quite clearly that there are particular challenges for families whose children have identified special needs in how they access sufficient and high quality care based on their children's needs and their families' needs. We are also working carefully to ensure that while we make adjustments and adaptations to the preschool delivery system, that we do not do harm to the existing infant toddler spaces that exist for families. It is a known entity in the early childhood field that you must serve preschoolers if you are going to serve infants and toddlers, because the economics of the cost of infant toddler care don't make it possible for you to not make that combination. We need to make sure, as we continue to fund spaces and expand childcare, that we are expanding in the infant toddler area as well as in the preschool area. This endowment will increase the rate of pay for early childhood funded spaces under Early Start Connecticut, which ultimately we anticipate will help us raise compensation for the workforce. Compensation is low, turnover is high, and we need to stabilize that system if we are really to impact children's learning and development through high quality programming. The endowment allows us time for system planning. We are beginning to roll out some pieces of the endowment now, but FY27 is when we will see the greatest amount of expansion. We have built in family feedback and input and community feedback into the system, and we are making sure that we are collaborating with our governor's office, with legislative partners, to ensure that the endowment is accomplishing the promise that it makes to support early childhood. Next slide, please. So how are we improving affordability, access, and quality? To begin with, Early Start Connecticut will provide free childcare for families earning up to $100,000 per year. And for families earning between $100,000 and $150,000, they will pay 7% of their income for early start spaces. We're increasing rates for programs and for school districts. The trust fund gives us a sustainable approach to funding. It allows us to be planful about expansion. We are building this system on the current local, state, and federal funds that we have in place and the programs that we already have operating, and we are filling gaps and expanding spaces. This will help us extend the length of day for some families in their care arrangements. It will help us add additional spaces for full day. It will help us serve part day spaces where necessary and where needed. The portal that is part of the legislation will give parents the opportunity to find care based on where care is available, not just where it is located, which is what we're able to deliver right now. This will help us increase parents' ability to access care that is what they need, where they need. It will also help improve our data about where children are being served and where there are available spaces. In all, this improves the whole system because we are addressing spaces, workforce, accessibility, quality, and infant toddler care through the whole system. Next slide, please. So some of the features, and I've already touched on a few of them: affordable or free high quality childcare for families who are eligible for spaces, easier to access information for families as they search for and secure childcare, data-driven community planning. The endowment helps us establish what we're calling local governance partners in communities where there will be locally based planning about how spaces are distributed, about how providers are supported, and to help families access more information about early childhood services. The system creates 20,000 new or extended childcare spaces by 2032. And as we strengthen the whole system, we are moving toward increased compensation that will allow us to support a stable and consistent workforce, including in the infant and toddler care system. This is both a Connecticut economic initiative as well as an early childhood initiative. Next slide, please. Make sure we're matching. Thank you. Our goal here is to really wrap children and families with services that they need, a statewide system that is implemented with local decision-making and local input. We are looking to provide empowered information to families and to make sure that we have parent voice at the table through our systems and our system building. We're strengthening collaboration and establishing a shared vision. Partnership and relationship building is really important to this work, and we need to maintain it. We're improving access equitably across the state and in communities. We want to make sure that all children and families have access to high quality and supports for their family needs. And we're promoting best practices that will help us ensure that children's learning and development is consistently supported through intentional planning and intentional play. I'm going to turn over to Kristen, and she's going to talk a little bit about the legislation.
Thanks, Deb. So as Deb mentioned, Senate Bill 1 is the bill that passed this past session. Mackenzie, if you can go to 2 slides down, one more. Thank you. This was the Senate priority bill this past session. So I think that speaks to both the state's interest and investment in early childhood education. But this is the bill that establishes the Early Childhood Education Endowment. So the endowment is a trust fund, as Deb said too, meant to be sustainable and grows over time. So every year, the unallocated surplus is to be deposited into the endowment fund. This year, the fund was capitalized by $300 million for an initial deposit into the fund. We are allowed to use 12% this year and next year of the total deposit that's in the account. So this year, we're allowed to use 36 million of that 300 million in the endowment. We do have an administrative cap, which I'll get into the definitions of the different types of costs, but we do have an administrative cap of 8% this year, and that is encompassed within administrative costs is OEC staffing to build our capacity internally, and as well as IT and data infrastructure needs. Next slide, please. So there are a couple ways that OEC is allowed to use this fund. We are allowed to use this for expansion costs, which goes to a little bit of what you just heard Deb talk about. So the increased rates per space that OEC pays to providers, expansion, adding additional spaces into the system, and then ensuring that 35% of the new spaces go to infant and toddler care. And that is the way in which we go about making sure that we do not leave infants and toddlers behind to break the system. We did this specifically because we have heard from and learned from other states who have implemented a universal preschool model that you have to include the infant toddler care. We're also allowed to use the funds for programmatic costs, which you heard Deb also talk about local governance partners, LGPs, technical assistance, training, professional development for our workforce, as well as how we communicate and make the entire field, parents, educators, advocates, legislature, all aware of the happenings of the endowment. And then I already spoke to administrative costs, which is for staffing, data, and technology systems. But the big affordability part of the bill, which is what the majority of families are interested in hearing about and knowing. I'm sorry, Mackenzie, can you go to the next slide? Thank you. We know that on average, parents pay between 16 and 27% of their income on childcare. That is a huge amount of money. So in response to that, beginning July 1st, 2027, through the Early Start Connecticut program, childcare, as Deb mentioned already once, but just want to be a little bit more specific, childcare will be free for families who make less than $100,000 per year. And then families making over the $100,000 a year will have a 7% income cap on what they pay for childcare, and that will be up to 7%. Also, sorry, Nick, thank you. With the endowment, there is an advisory board. We actually just had a meeting right before this. So the advisory board is in place to oversee and advise on the uses of the funds for the endowment. So there is a tri-chair composition for the advisory board. The tri-chairs are there's a member of the Senate, a member of the House, and then the Commissioner of the Office of Early Childhood. So currently, we have Senator CC Marr, who sits as a tri-chair, State Representative Kate Farrar, who sits as a tri-chair, and then the commissioner, our interim commissioner of OEC, Elena Truworthy. There's an impact analysis that will be due to the advisory board in 2032, which seems very far away from now, but it's really not. And that will be an analysis of the endowment and the impacts that it's had on the complete early childhood field at that point in time, including Early Start Connecticut, which is how the majority of the expansion is happening, but also those providers who are not Early Start funded, who might be private pay, who they could be nonprofits, who don't receive any state subsidy, and then the impacts on them as well. So that can help inform us moving forward and how we can best use the endowment. Another part of this bill was the health insurance subsidy that came in. This was a huge push from the legislature, from the House of Representatives, to include a health insurance subsidy pilot program for early childhood education. This right now, actually, the study just went out, or the survey just went out to early childhood educators this week to really understand the challenges that are happening with health insurance. A lot of the field does not have access to health insurance, mostly because the programs that they work for can't afford it, or because family child care providers are not able to afford it. So the first year is a study. So we are paying $300,000 this year to understand the need for health insurance in the field. And then next year, state fiscal year 27, there is $10 million allocated in the endowment to operate a pilot program. And then the findings of that pilot program will then inform any future expansion of the health insurance subsidy. Another component of the 3 bills that passed is House Bill 5003. This was one of the House priority bills as well. And if you can go to the next slide, there you go. Thank you. One thing I want to point out on the health insurance, I apologize. The little gold star that was on the slide means that it is available for all programs and educators in the field. So you've heard us talk a lot about Early Start Connecticut and how the endowment supports Early Start Connecticut, but the health insurance subsidy will be available to all, up to all. All educators will be able to apply for the subsidy. Apologies. So you'll see that the gold star here is on the one point of entry portal as well. So this was I'm not going to go into all of the components of House Bill 5003. There were many. This is just kind of the one that we're highlighting today, which is the one point of entry portal. So this portal is supposed to be an opportunity for parents to have one place that they go for all of their childcare needs. They need to find a program. If they would like to enroll in a program, they will be able to do that through the portal as well. If there are supportive services that they need, the portal will direct them, such as birth to 3, home visiting services, things of that nature. Also for providers, this one point of entry should reduce the administrative burden that is on them to enroll families and to keep track of the paperwork. And then for OEC, this one point of entry portal improves our data collection and how we can tell the story about how the endowment is helping to build out. Next slide. This is just kind of a visual. So as we understand the needs of the families will then enter into the portal. They'll be able to have some type of a navigation support, most likely within the OEC, to help those families get directed to what it is that they need. If they have a child with special needs and they need to find a provider that can meet their needs, and then actually being able to enroll into that program. Next slide. And then the third bill is the bond bill, House Bill 7288. And this is a bill that offers opportunities for childcare programs to invest in their facilities, to apply for facilities grants, which will help with construction or renovation of their spaces. And there was 80 million allocated in the bond bill for facilities for childcare, which equals out to be about 11.7 a year over the next 7 years. Next slide. One more. There we go. Thank you. Something that's happening right now, and this was the announcement that the governor made yesterday during the press conference, is an RFA, which is a request for application, is going out to the field for new providers into the early start system, existing providers, to apply for the additional 1,000 spaces that were announced yesterday. And something I think that is worth flagging is the endowment statutory language puts additional layers of requirements onto the early start programs. So again, the 35% must be used for infant and toddler spaces. That's a requirement in statute, as is programs being required to participate in our quality improvement system called Elevate. And that is an opportunity for the workforce to participate in professional development and helping them work towards accreditation, national accreditation for their program. And then also participating in the Child and Adult Care Food Program, CACFP. Next slide. Oh, sorry. These are not just what, no, we don't need to do these slides. Sorry, Mackenzie, thank you. We are out doing listening sessions currently, so these are the slides that we've been using for the listening session. So I apologize, I should have removed those first, but I did not. So I guess I'll open it up for some questions. If anybody has questions
For
about
sure.
the
If you have
endowment.
questions, just raise your hand. If you're online, just raise your hand. I can kind of start. Thank you so much for that. This was very helpful. And Deb, how do you spell your last name? Is it F-L-I-S-S?
It's one S, but thank you for asking.
Thank you. I just want to make sure. So you are going to be working with, I'm assuming, for-profit and nonprofit providers, correct?
That's correct.
Considering what we've been, dealing with here on the committee, has there been any feedback from these providers on like, hey, we're having trouble getting liability insurance?
Such an important question for the childcare community. Thank you for being interested. We have been hearing essentially the same things that you've been discussing in these meetings. Providers are struggling with increased rates. They are struggling with being dropped from their carriers and having to find new insurance. We are hearing from them, and we're struggling to actually identify this in specific data, but we are hearing from them that federal requirements to share more information about providers' compliance with Connecticut's health and safety requirements through our licensing system is making it easier for insurance companies to look for data points that inform their insurance coverage and may in fact be resulting in increased rates or dropped coverage. We have not done a survey yet to actually obtain more specific information about that, but we have been in a conversation with the Department of Insurance staff who have been very gracious about helping us understand insurance requirements and the process of dropping coverage so that we can consider survey questions that will inform us about what exactly is happening in the provider community. You are correct that our provider community is both privately operated programs as well as nonprofits. So I think in that respect, we look a little different than some of the other nonprofits that you all have been discussing here.
Yeah, because when you're looking at the numbers that you've presented to us, I mean, those are based on kind of a moment in time. And if we're getting, or these providers are seeing 20, 40, 60% increases, like that means we may have to adjust the income threshold, the administrative costs. Like, I mean, it really kind of destabilizes a lot of the numbers that were just presented to us. So I'm just saying that, we all know this. I'm just saying that because we need to solve this, because this is something that the state, the legislature, we all have invested heavily in. And the presentation's fantastic, but then we have this insurance issue over here. I want to ask about the $300,000 health insurance study. We could have saved you all $300,000. We've put out a lot of solutions on the healthcare side, but thank you. I'm looking forward to seeing, the results of that and working with you. This committee has been tackling this for about 4 years now. We've offered a pooling solution. We even did a specific bill just for childcare providers in this space, which would have, allowed everyone to pool together and purchase insurance. Seeing $10 million of taxpayer money going towards subsidies, we're basically saying we're going to pick one industry and help them out, but we're not going to help, the mom and pops on Main Street. We're not going to help the nonprofits who aren't in the healthcare space, so it's just a little disappointing. I know, we're trying to solve a problem here, but we're also telling other, groups that we're not working with them on this health insurance. I'd like to see us really try to solve, this at a level that affects every nonprofit in the state. So just something to keep in the back of our mind. I think at the end of our working group here, we're not even just talking about liability insurance really for nonprofits. We're talking about all insurance for nonprofits with this working group. So I want us to just keep that in the back of our minds, that at the end of this, I'd like our recommendations to include all different types of insurance. So we will do that with everybody's help. And any other questions in the room? George?
Thank you, Rep. Wood. I completely agree with those comments. I'm curious, because one of the things I've enjoyed working with your team, Deputy Commissioner, and as I was listening to the presentation and some of the issues that we've heard with the foster care, and one of the things that they talked about was doing background checks. And the frequency of the background checks is one of the issues with foster care. You might have background checks done once, and it doesn't happen on a continuous basis. And we all are aware of the recent case here in Connecticut that happened for a child care facility. And I think that that's a critical part of an insurer's being comfortable with risk. If they know that there's due diligence around everyone that has contact with children within a facility, and it's not just once, but it's also an expense that has to be incurred to make sure we're continuously and diligently doing background checks on anyone that can come in contact within that facility. Because I think insurers would feel, much more at ease from a risk perspective, knowing that, a family has a daycare in their house, but everyone that's in that house has to have a background. Not just once though, it's a continuous process that happens. And I know as you have these programs, and they were talking about expenses when a lot of this went into the nonprofit community from the state to the nonprofits, they're constantly battling with the expense component of running an operation. And so it's easy to say, well, we don't need to have multiple background checks. We can do away with this because we still need to control our expenses. So I think those are the kinds of things I think we're going to have to consider, so that it's not a one-time, it's a constant, doing these background checks and making sure that, families can be comfortable when they leave their children or an elder care or whatever it might be, or a foster care kid in a facility, that, we're doing a good job from a due diligence perspective to make sure that they are protected.
So thank you for raising background checks. So background checks are required per licensing requirements. They are conducted every 5 years. They are portable for staff, meaning if you change jobs in that term, it goes with you. In the family home setting, the provider and immediate family in the home are also background checked. I'm glad you brought it up, and I think it's a conversation we can have more deeply in our staff to staff conversations about how to share those licensing requirements and help insurers understand the system that is in place, and for us to hear back from them how that system lands on their side as well.
No, that's good. And I don't know if, 5 years is, that might be too long. What's the frequency? And I'd be interested to, talk to industry, what should be a frequency for doing that, with staff. And then anyone that can come in contact, food delivery, anyone that could be, coming into contact and be in that facility, I think you have to be comfortable and know what their backgrounds are.
I was actually going to ask if Brooke wanted to weigh in on that. Like, do you have any comments from the industry? Like, should there be every year, how do you get in front of the background checks in order to kind of mitigate any excess cost?
Unfortunately, I don't have that information, but I can look into that and get you that information.
Yeah, I think that would be really helpful. If you guys haven't done that yet, that would be a great discussion to have. And then we'll go to Representative Farrar.
I just want to add, I'm John Catalan with the YMCA's. The problem with the background check system currently is the state does not have the capacity to do any more than what they're currently doing right now. Takes a long time now to get a background check. So you're talking about a significant investment from the state to hire more staff if they're going to start background checking on a more constant basis.
And that's why I put that out there, because I think it's still something that has to be considered. And if you, as an insurer looks at risk, they need that confidence to know that that process is being done and there's cost to it, but it's what should be the right, frequency for doing it. And I think, making sure we have those safety, checks inbound. And is it just a background check? Is there some other means that need to be considered? I don't know, but I think we need to understand that.
And I think just to add to that too, there is a state responsibility that it comes with, but it also falls on the childcare provider. So currently right now the state is paying for background checks. That's only guaranteed through, what is it now?
End of this year.
The end of the year. Hoping to extend that a little bit, but there is a cost of about $90 per background check. It's like $88.75. And once the state is no longer paying for those, that becomes a burden on the childcare provider as well. And it is about, if the state were to continue to pay for it, it's about between 1.3 and $1.7 million a year to cover those background check fees.
And that's going to increase when you have 35,000 more spaces. So it's something that needs to be considered. And, because you also now have a lot more vulnerability. So we got to figure, how to fill that.
We are definitely spending money here today. Representative Farrar.
Thanks, Representative Wood, and apologies, I had joined the meeting late, but I'm not sure if this was covered, but given the conversation we're having related to OEC's work, and thank you, OEC, for being there today. I just wanted to acknowledge, I know OEC is working through some requirements related to legislation we passed together just this last legislative session about a report on some of these insurance issues, and also a report to the legislature about the background checks issue as well. So I leave it to them if they hadn't brought that up to acknowledge that. But my question is actually related to this being a national issue about the insurance rates. And I was curious if OEC did, or if they hadn't, could share with the working group the information from the national organization, NIAC, about the insurance rates, and if there's other state examples of how other states are addressing the insurance rates from that national organization. So if they could comment on that, that would be helpful. Thank you.
Thank you, Representative Farrar. I had not commented on the report, but I had it here on my list to share. And we've started working on that report. I don't believe that we have shared the NAEYC information. They have done some data collection and study about what's happening across the country. related to this issue, and we will share that over. I don't know of any state examples where this problem has been solved. I see a lot of activity on the state Child Care Development Fund listserv, where state administrators are asking questions about what's happening at the state level. And what we've all talked about here in this room is exactly what those comments mirror. But I have not heard anyone say, here is the solution that we have put forward, and here's how we've changed what's happening in the market or how we've been able to support providers.
Thank you for that. And thank you for your willingness to share some of that national data, because I know some of the state data might be hard to come by, and that would be very much appreciated. And thank you, Representative Wood. Obviously, we're working in real time with other states that are trying to address this. And I think working closely to make sure that the insurance industry understands the inner workings of childcare is a key piece of that. So thanks for gathering us.
Thank you, Representative Farrar. And I'm going to pass it over to Michael McLaris, but Michael did present, I think, at our first or second meeting regarding the SIFSIC fund and using a similar model here to solve it. And which means, by the way, that we would be kind of an outlier to the rest of the country if we pursue this captive insurance. And Michael is drafting some language for all of us to review. No pressure. But I do
help.
I do want to pass it over to Michael for comments. Thank you, Michael.
Thank you, Representative Wood. Actually, two comments and a question. The first comment is very, very nice presentation. It really illuminated a lot for me. And what you were both very ably able to do was to connect the dots between the initiative itself and the insurance issues that we're addressing. And those dots needed to be connected. And thank you for doing that. With respect to privatization of background checks, in my career, we've established a half a dozen captives that specifically focus on background checks as part of a liability program, where the captive actually does that. It privatizes it. Now, nothing against state government. State government does the able job that it does, but as this gentleman who I don't know said a moment ago, resources may be limited or staff may be limited. It is a common practice in the captive insurance industry, not only my firm, but everybody. We build background checks into the underwriting process of a captive insurance. We take it right out of the hands of everybody and say, here it is. And where it actually started was with motor vehicle checks. Many captive insurance companies underwrite automobile coverage of one kind or another. And there's a very valuable annual motor vehicle check that's done in many of these captives. And that's, while not a healthcare parallel, it certainly is a parallel related, pardon me, to the expense and the timeliness of getting it done. My one question, Representative Wood, was structure. Can we go back to the beginning? I'd like to actually understand your structure. Are you part of state government? Would you consider yourself to be?
We are, in fact, a state agency. We were established in 2013.
Okay.
We're just babies.
That's from, as an underwriter and as a captive insurance consultant, that's a very important point for me, because the nexus, the connection between what you do and 501c3 tax-exempt organizations and for-profit or taxable organizations, that insurance nexus is going to be very important. Here you stand with funds, right? Here you stand with the availability of talent to administer those funds. And it's sort of like being all dressed up for a prom, but not having a date. If what happens is you've got the funds and the staff, but I can't afford the insurance to administer what you're giving me. And that's the important nexus for this committee to consider in future, I think, because in order for you to effectively do what you must do, and what, in fact, we need you to do as citizens of Connecticut, you must have the collaboration of people who are struggling with an existential crisis on the purchase of insurance. So I make that point.
Thank you.
And I hope it's helpful.
Representative Farrar, do you have another question, or is that left up from the previous one? Okay, perfect. All right. Ben?
Just to say what the Deputy Commissioner just said about what's happening in other states is exactly what we're hearing on the human services side, that this is an issue everywhere. It's probably not like quite at a crisis point where the situation that Mike just laid out is happening to every provider everywhere, but it's getting worse, and it's getting worse quickly. Background checks is, I think, is a part of this, but is a very small part of what an insurer is looking at. There's all sorts of things. I have also heard, I think, from some early child providers, but also from others that, you know, their interactions with the state's various licensing agencies, OEC licenses early childhood providers. My members are also licensed by the Department of Children and Families, the Department of Public Health, certified in quality metrics from 5 other state agencies. And so all of that creates a paper trail if there's an issue, and an insurer is going and doing a review of issues that you've had, even if some of those things aren't actually indications that your programs have anything really wrong or there's increases a risk for an insurer. They are all things that insurers can take into account. And so that, and probably a number of other areas, I'm not sure it will be as simple as having the industry sort of give us some cliff notes of things that providers could do more of that would make their calculation different in terms of who they're able to insure. I think this is clearly something that is being evaluated on a scale that's much larger than Connecticut organizations and the different ways that they interact with the Connecticut state infrastructure that oversees them. This is like adults serving kids that they aren't related to is risky because bad things happen sometimes. And so it's something that is going to be a lot more expensive for us to be in the business of insuring generally. And so I guess as we're looking at a solution, one of the things that I want to encourage, I'm encouraged to hear that Mike is working on some language, but is to think about if what we do here is scalable. There's other examples around the country where there are nonprofit like insurance companies that started many years ago that insure organizations outside of their state. And so as we think about this, just making sure that it's not so narrow as like child serving organizations only, or even organizations in Connecticut only, because I'm just, we're working on collecting some data right now, and it does seem like pretty universally folks are dealing with this issue, whether they're serving adults and kids, whether they're being dropped yet or not. It's definitely something that's happening.
May I offer a thought, Representative Wood? 2 thoughts. Ben is right in his comments about this being a national issue. We know that from the data that's available. We know of an initiative in Washington State. In fact, I'm involved with that initiative. We know of an initiative in Arkansas, small initiative that's just started. But I would offer a thought in which I take a little bit of pride as being a Connecticut resident and taxpayer, and that is the crumbling foundations crisis, which is a multi-state crisis, was first addressed in this state and has been largely solved. And by the time we sunset this program in 2030, it will have been solved. The property insurance model that's being used in the state of Arkansas now is been completely ripped off from Connecticut. I use that not as a term of art or law, but simply as a statement of fact. So Connecticut has a history of cutting-edge involvement, partnerships between state government and the private sector, of which CIFSIC is an example, the Crumbling Foundations program is an example, that in Ireland, as I speak, the government of Ireland is now employing the CIFSIC model. Period, paragraph, end of story. So we have the ability to do this. We also have something called the Federal Risk Retention Act of 1986. And the Federal Risk Retention Act, as George knows and as Fenwa Liu knows, who I see sitting here, is an act that enables you to take whatever you do in Connecticut to the extent it's viable and makes financial sense, and broaden your reach across state governments using the law that preempts so much of some of the stuff we have to do in the industry. The Federal Risk Retention Act of 1986 has been an enormous life-saving mechanism to healthcare providers since October of '86 when it was promulgated by the feds. So you have the kernel here in Connecticut of the impetus and the creative thought and the energy to do this and then move it out of the state as well. And provided you do that in a good way, which rewards the state of Connecticut for the taxpayers' intervention and investment, I'm all for it. And it's easily doable and easily scalable.
Thank you, Michael. Any other questions or comments? And I just want to follow up on your comments that we definitely will not have blinders on when we offer solutions. I mean, we hear you loud and clear. And I think there's a lot of other speakers who haven't come in yet. I will just let everyone know that DCF, I see Deputy Commissioner Russo over there. They have agreed to come to a future meeting. I have reached out to the trial bar a few times. I will continue to do that. I think they're an important voice to have at the table. And if there's any other suggestions for speakers that you want to hear from, please reach out to our new clerk, Mackenzie Fournette. Unfortunately, Allie Keif, well, fortunately for her, has moved over to the Finance Committee as clerk. Congratulations, Allie. And Mackenzie is taking her place, and she has hit the ground running, and she's fantastic. So please say hi when you can. But yeah, we definitely want to get all the different perspectives because, as Ben says, this is not going to be a one-size-fits-all solution. There's so many different things that we can do here. You know, there's some smaller steps like dealing with background checks, and then there's larger solutions to dealing with, you know, auto insurance versus liability versus health insurance. So we're gonna talk about all of those things and keep doing it. And I do want to recognize Deputy Commissioner Fenwa Liu, who has been leading the charge and creating a state here that is open to the captive insurance industry that is exponentially growing and expanding, that Michael's been a part of. So we do have a lot of tools at our fingertips, and I'm looking forward to continue this discussion. That being said, 2 weeks from now is the Friday after Thanksgiving, so we don't want to call everyone to the table on that day. Do we want to look at the following Friday, which would be the 5th? Same time? Okay, so
It might be interesting to actually hold the meeting the day after Thanksgiving and see who shows up.
Yeah, those are the true warriors. Mackenzie, if you could schedule that, and then we will try to fit one more in. So we'll do 2 more before the end of the year. I think we'll take the month of January to start putting some, you know, thoughts together of a report that we can put together or recommendations to the legislature, and then we can be prepared for the upcoming session. Any other comments or questions before we adjourn? Thank you everyone for your time.